last little bit, 10 minutes just to sum up. We started the day with a call for action, and we're going to end the day with a call for action. Because this is not all about sharing ideas and thoughts and so on. This is, the world is in trouble, and we have a significant role to play, and we have multiple reasons why we in the healthcare sector need to do this. So a call to action, and I'm going to pick up on some of the themes that we saw within there. But again, it's much more powerful when you talk to each other, as you just did, than when we talk at you. Those who were part of the forum 2 years ago would have heard Dr. Ronnie Cohn speaking to just how much of children's illness, of pediatric illness, is related back to climate change. And I believe the number he used was in excess of 80%. I should have checked that. But Dr. Cohn is telling us that this really matters. This is a healthcare issue. It's a public health issue, not just an environmental issue and a responsibility. That recording and all recordings are up on the Greening Healthcare website. I believe the talk was about 20 minutes. I have played it back for myself 3 times since that first recording, and it still moves me and it still motivates me. Last year we had Dr. Penny Ballum talking about running out of time. And this was, it was an emotional moment when she talked about Kelowna burning. You know, again, former city manager of Vancouver, former deputy minister of health. Penny is not given to hyperbole. But when she saw Kelowna burning, she said that's the first time she sensed climate anxiety. And I know a number of you are involved with mental health facilities around here. We're watching the mental health impacts of climate change, especially on young people, because they know it's here and it's not going anywhere. So this idea, in the worst possible way, that we're creating our own customer base, you know, that's just not the way we want to go. But running out of time, and we feel that very strongly. We feel the urgency of this stuff. We just absolutely have to get this right. And these are now the themes of these words. If we did a word cloud of the day, these would be right up there. It's urgent. 2030 is a really important deadline. Last year, it was 7 years away. Right now, it's 6 years away. Soon it'll be 5 years away. We are running out of time. There's a real sense of urgency. Talking about climate change as the defining issue of our times, it absolutely is. It's, we look back to COVID. It's not so long ago, and that was devastating on mental health, on social cohesion, on the economy. Like, COVID was a disaster. If we measure it just in terms of the number of mortalities, the number of people who died of COVID, that number is now up to 7 million. You can get all this information from the Global Humanitarian Forum. That number is up to 7 million now, but it's leveled off to about 300,000 a year. That's still a lot of people, but it's comparable to the flu, which is around 700,000 people a year who die worldwide from that. Malaria is about 600,000. So COVID kind of calmed down. It leveled out. There's still too many people dying, but climate change, by the most recent count, we saw over 200 people dead from the flooding in Spain. We saw 375 US deaths so far in 2024 due to hurricanes, due to floods, due to the things that we see. So by somebody's count, we're up to 315,000 people a year dying of climate change, and that number will grow to 500,000 by 2030. And it will keep growing, because while wars are devastating, we've got a number of our employees who are from Ukraine, from the Middle East, from Venezuela. They're devastating. Eventually they come to an end. Climate change is not coming to an end. It's only a question of how bad we let it become before we take effective action to deal with it. So the idea of 2030 targets really, really matter. And the idea, if you're willing to, that as the healthcare sector, we commit to that 30% reduction of emissions due to facility operations by 2030. And again, it's not that everybody's going to save 30%. It's that fair share that we talked about this morning, that everybody goes away from here and says, yeah, I can do that. I don't need major capital dollars. I respectfully disagree with that word cloud that said funding was the biggest issue. I don't believe it's the biggest issue at all. I think the money is there to make the changes. It's the commitment. It's finding the time. It's finding the partnerships, finding the collaborations. Who can I work with? But most of all saying, we can do this and we have to do this. Again, we've got children. I've got a lot of grandchildren. We have to be able to tell them what were we doing during the climate crisis. And we did our part. That's a big deal for me. So the idea of certainly thinking globally. It matters when the COP conferences take place and everybody gets together and renews their commitments and talks to each other, and we get a lot of press. But the people at those meetings cannot affect the change. You can. Every hospital in this room. You can kind of make that change, and leaving here today, if we're successful, most of you, and ideally all of you, will say, yeah, darn it, we're going to do this. We get it. It matters. We can. Michael will be bombarded by calls over the next few days from you saying, kind of looking at my fair share thing. What was my target again? Where do I go from this? But that you engage, you find the time, you make the time, you form the partnerships, you form the collaborations. Urgency, opportunity to do the right thing at the right time, which we all want to do. Otherwise, why are we here as humans? And responsibility. The healthcare sector really has a role to play here. So we talked about the call to action. This is really bringing back what I shared with you this morning. It's collective awareness that what we're doing right now is not working. But we have so many success stories that we've shared today that we know how to get this right. We know how to do this. So it's not that we don't know how to do it. It's, do we have the will to hunker down and make it happen? And you've heard from people who, despite the odds, despite the challenges, have done this. Collaboration's been the theme of the day. We can work together. You should have met people that you haven't met before today, including our exhibitors, and give calls to them. You also, exhibitors and industry, heard the admonition from our panel saying, don't come pitch to us, come understand us. In our perfect world, you'd be sitting down with hospitals where you have relationships and show me that target again. Can you show me, wow, you're supposed to save a whole bunch of gas. You know, I can help with that. So engaging at a much more strategic level than just, can you buy my stuff? It's how can I adapt my stuff and make it fit the needs to get you to where you need to go. Industry can do that. I believe hospitals will always be short of resources, and industry is there to do that, but not necessarily the way that you're putting your services out there today. We do need new service delivery models. We need new relationships, and they're long-term relationships, and they take collective accountability to get us where we need to go. So this is all about commitment. It's all about working together. It's all about understanding your share of the pie and where that's going to go. Now, I do my shameless pitch. I mean, just come on, but we genuinely do try to understand what Greening Healthcare as a nonprofit can do to help. We work in the 3 pillars you're aware of. We're either new hospital performance. We've talked a lot about that. We publish our report every year. We've talked about existing hospitals, energy efficiency, and we're focused on decarbonization. What does it look like? What does that capital planning process look like? How do you get there from here? That's what Greening Healthcare is. Join us if it's the right idea at the right time. If you can do this on your own, God bless you, make it happen. We'll still be tracking the numbers. But if it makes sense to you to join a whole bunch of folks who are trying to not reinvent the wheel, but work together on solving this, we'd love to have you as members. My colleague Heather at the back there, and we'll give you all the contact information, would love to hear from you. We probably talk to a hospital every 2 or 3 weeks that is interested in where we're going, and we make it clear. If this is not the right idea at the right time for you, that's fine. Most of what we do, our website, our reports, All of those are open to everybody. You don't have to be a member, but if we can help you move forward, we would love to do that. And final thought is contact us. I'm Ian Jarvis, the Executive Director of Climate Challenge Network. And again, Heather, do you want to, if after a long day, you can stand up. Good. Heather would love to talk to you. I think I've mentioned to a couple of you, it's interesting in the last 6 months that a majority of the calls when we reach out to hospitals come back from the CEO. It's the CEO saying, I want to hear about this, not necessarily the facilities director. But Michael Pagel's our program manager. Michael, take a bow, please, because Michael pulls all this stuff together. And you've heard earlier today from Amandeep, in my view, and the fact I work with him is not directly here. Amandeep is the most knowledgeable person in this space technically that I know, because he simply works with so many of you and he steals all your ideas mercilessly. So that's our day. That's we've got the cocktail. Again, thank you so much. I think about 80% of the folks here are still here right now. Please join us and keep talking to each other. And again, on the way home, think about tomorrow and think about 2025 and think about 2030, and let's make it happen. Thank you very much.